Our speaker, Wendy Dolin. It's always good to introduce another Wendy, especially one that's come all the way from the USA. Wendy very sadly lost her husband to suicide, and since then she has campaigned to raise awareness of the side effects of antidepressants.
Thank you very much, Dr. Byrne. Yes, another Wendy. And Dr. Smith, thank you so much for your wonderful presentation on akathisia. I'm Wendy Dolin, the founder of MISSD, and we had started our original mission to increase awareness for side effects. Our simple mission statement is, when you stop, start, or change the dosage of any medication, side effects can occur. When I originally started MISSD 8 years ago, we were primarily focused on the SSRIs and antipsychotics. However, during our last 8 years of programming and extensive dialogue with medical professionals and consumers, we've expanded our mission to include many classes of drugs that cause akathisia. And in your presentation, Dr. Smith, on our CEU program, we list many of these types of medications. Originally, we were primarily focused on acute akathisia. But then as time went on and people were contacting us, we started to focus more attention on withdrawal akathisia, though on our videos and presentations, we also talk about tardive and chronic akathisia. And basically, our message is simple. If you start a drug, and for whatever reason you started the drug for, your symptoms get worse, contact your prescribing doc. Our objectives are to review akathisia clinical presentation, discuss internal and external symptoms of akathisia, gain insight from cases and experts by experience, and explore assessment challenges and opportunities. The next 10 minutes may help save a life. Akathisia is a disorder induced as an adverse side effect of medication. It can cause a person to experience such internal restlessness that the sufferer is driven to violence and or suicide. The neuroscientist that was mentioned earlier coined the term in 1901. How ironic that this was in the 20th century, and here we are in the 21st century today, and we still are not having robust discussions on akathisia. The word akathisia is derived from the Greek word akathemi, meaning never to sit down. In 2 peer-reviewed journals, Dr. Roger Lane, formerly medical director of Pfizer's Zoloft product strategy team, discussed akathisia-induced suicidality and SSRIs. In 1998, Roger Lane wrote of akathisia sufferers, it may be less of a question of patients experience fluoxetine-induced suicidal ideation than patients feeling that death is a welcome result. Today, MISSD, and when you leave today, I hope you will pick up a packet since they were shipped all the way from Chicago. And in our packets, we have 2 types of information. One that it just has our brochures and our PDFs that explain what we do, but we have another folder that we bring when we present to doctors. And what's included in that packet is a lot of unsealed documents from various pharmaceutical companies that show that they were aware of suicidality and they were aware of some of the hidden side effects. What's ironic is one paper in this folder states that these findings should not be given to general practitioners, only psychiatrists, which is ironic. At least in the United States, most people get their antidepressants and medications from their internal medicine docs. So what we have done is we have produced, I speak all over the world, and I present to so many different types of group that we put together some educational videos. As of this morning, the 2 that you are going to see have almost 125,000 views.
Every day, people around the world are prescribed medication. However, when starting, stopping, or changing dosages, especially those for mental health conditions, there can be unexpected side effects.
I couldn't sit still. I was pacing up and down. I was crying.
My mouth felt like I was sucking on a battery.
I felt like I had worms crawling under every inch of my skin.
Side effects that steadily grow more severe until they become unbearable.
I attacked myself with a knife and was hallucinating.
I knew that if I didn't die from it, I would kill myself.
It felt like I was being burned alive.
I wanted to die.
It's called akathisia, an intense inner restlessness brought on as a side effect of medication. As many as 5% of patients taking certain medications suffer from akathisia, and for them, the feeling of being unable to stop moving becomes torture. Death can be a welcome result. Unfortunately, many patients and their doctors don't know enough about akathisia. Help us spread the word about akathisia. By learning more about this disorder, we hope to empower those suffering and their loved ones to take action before it's too late. If you or anyone you know is showing signs of akathisia, call your doctor or emergency services immediately. For more information about akathisia, visit our website at MISSD.co.
Medical literature sometimes calls akathisia a movement disorder, but this can be misleading. Sufferers may sometimes be able to control akathisia-induced movements for short periods of time. Therefore, the absence of observed physical movement does not mean the absence of akathisia. Akathisia should be considered more a sensory motor disorder. This next public video that we produced was a collaboration between veterans groups, first responders, and police organizations. They kept saying to us, what does akathisia look like? So this was our most recent one that was just produced a few months ago.
Akathisia is an intense inner restlessness brought on as a side effect of medication. As many as 5% of patients taking some medications can suffer from symptoms so severe that it sometimes drives them to violence, self-harm, and suicide. Akathisia typically occurs when a medication is started, stopped, or changed in dosage or type. It is during these changes that it's critical for others to watch for symptoms of akathisia. But as a first responder, medical professional, family member, or friend, how can you identify symptoms of akathisia in a patient or loved one? Visible symptoms to watch out for include rocking back and forth, pacing, marching in place, inability to be still, shifting weight, unusual or violent behavior. Less visible symptoms can include an increase in insomnia, anxiety and agitation, irritability, impulsivity, aggressiveness, hostility, and panic attacks. The following videos were recorded by people suffering from akathisia.
I sleep 1 hour in 24 hours for the last week.
I just want this to stop. This is what it looks like for me a lot of the time. This hurts. It hurts. It hurts.
If the situation is urgent, call emergency personnel or go to the nearest emergency room for help. By recognizing the symptoms at the onset of akathisia, those suffering can be helped before it's too late.
In practicing patient safety in psychiatry, Dr. Geeta Jayaram said scientific research in the area of patient safety in psychiatry is in the preliminary stage. The American Psychiatric Association's 2003 Task Force on Patient Safety encouraged psychiatrists to engage in dialogue with patients and families about patient safety issues and report, analyze, and learn from preventable adverse medication events. We receive thousands of comments on our videos. If you look on our YouTube channel, you'll see the thousands of comments from people that write in. And today I want to share one of the fellow medical professionals who wrote in about akathisia. This was in response to someone writing about akathisia. She wrote on our blog, "Let me tell you, it's the worst thing imaginable. You just want to die. It's inner turmoil that cannot be imagined unless you've experienced it." And this is how the medical professional responded to her on our blog. First of all, I want to say that what you're going through sounds dreadful and you have my full sympathy for what little it's worth. Second, I want to thank you for taking the time to give such a detailed response. I'm a med student, and some of our textbook descriptions of side effects and disease symptoms are pretty bland. For example, my previous understanding of akathisia was that it was a restless inability to sit still, which is nothing compared to what you described. The lackluster definitions and medical dictionaries make it easy for us to miss or dismiss it entirely. So maybe it's not that the doctors are uncaring, which is a real issue in and of itself, but perhaps it's that we don't appreciate the magnitude of some symptoms due to a flaw in the way we were educated about them. If we had concise, patient-provided description of symptoms, then we might be able to better appreciate the magnitude of these conditions and give them the true attention they deserve. Anyway, thanks for helping me understand and appreciate akathisia to a more realistic extent. I know that this doesn't help you directly, but I'm sure it will help my future patients, so maybe there's some tiny comfort in that. It also gives me some ideas for improving our current medical education system. We learn from factual stories. So my husband, Stuart Dolan, was 57 years old, an international lawyer who was prescribed Paxil for mild anxiety, and 6 days later he died. Looking backwards in time, he was exhibiting signs, but the night before he died, he was at dinner tapping his leg and said, "I don't get it, Wen. I still feel so anxious." And to hear today is Christina, who also lost her daughter to akathisia. We'll hear some quick words from her. And also today, I met a woman, Sarah, who I'd never met before. She's British. She heard about us and lost her brother to akathisia in September and is here to support us.
I'd like to thank Miss for inviting me today to briefly summarize my child's prescribed demise. There's no bio about me because I wasn't planning on speaking, but my name's Christina Kaiser-Gerke, and prior to my daughter, who was 19, prior to her death, I went around the country and I presented professionally, of all ironies, how to communicate crisis and risk. I finished my graduate degree in London years ago. My undergrad is journalism, my master's is strategic communication. I have graduated from the Center for Creative Leadership and many, many patient advocacy programs. Anyway, Natalie Gerke was 19 and 5 weeks old on February 6, 2013. She never received any concrete diagnosis. She was prescribed sertraline, which is Zoloft in the US. Her doctor stated that she prescribed it for, quote, OCD-like symptoms connected to dieting and exercising. Natalie was petite like me, her mother, and she weighed 110 pounds. She was approximately 4'11". I want to talk about the physical components of this toxicity. Even though in the US there is a black box warning, it's not required to be communicated. So Natalie was a freshman in college and she was living at our home at the time of her prescribed demise. I watched Natalie dying in the 2 days before she died, but I didn't know what I was seeing. I didn't know what I was seeing because Natalie did not receive any kind of information about the over-the-phone drug increase, and I was not informed that something had happened to her chemically. On Monday, February 4th, she called the doctor and complained about fever and flu and thought that she had the flu. She must have cried on the phone as well, but I'll never know for certain. But at any rate, the doctor made the decision over the phone without seeing Natalie and without making a clinical observation. The doctor told Natalie, who had the drug in hand, to start taking the maximum legal dose of Zoloft allowed. So Natalie followed her doctor's advice, and she didn't think to tell me because since she had taken Zoloft, she thought that it was safe. So on Tuesday, she took 200 milligrams of Zoloft, and on Wednesday, she took 200 milligrams of Zoloft. She died the second day of 200 milligrams of Zoloft. She died a very violent death that is not a consistent death for someone who has mild OCD-like symptoms and no history of depression. She did try to document for us all in this room what happened to her. She wrote down, "I keep coughing up blood. I have no appetite. It's time to take my meds." I want to share with you briefly what kind of physical symptoms she exhibited. The coughing up blood is well documented in medical research. Upper GI bleeding is an adverse effect of SSRIs. Next, the night before Natalie died, she was having trouble walking. She was shuffling her feet and her gait was quite wide. I thought perhaps she had cut herself on her thigh, or maybe she had a rash because she was walking with her legs far apart. This kind of toxicity builds up in the front lobe of your brain, which is where balance occurs, and you'll see in the medical research that change of gait and shuffling is a sign of this drug toxicity. Next, Natalie, who had an IQ off the charts and was incredibly intelligent. She was one of the reasons she got into the psychiatric care was that in second grade she was diagnosed as brilliant and sent to a school for very advanced kids, and I took her to a psychiatrist to get her help with the new school. But I digress. But Natalie, who was suffering these symptoms and didn't know what they were, she took to her own to look it up on the internet. So she had told me, "Mom, I know what's wrong with me." And I said, "What are you talking about? What's wrong with you?" And she said, "I have," and she gave me some weird sounding word, and she said it's uncontrollable skin picking. So I will just leave you with the 4 symptoms that I saw, but I didn't know what they were because I was never informed to watch for any symptoms and report them. I saw my daughter had a change of gait and she was shuffling her feet. I saw that she had a swollen face and it was very white and fleshy. She thought she had the flu. She complained of nausea and vomiting. I didn't see her cough up blood, but she marked it down on her paper while she was still not quite too delirious. And lastly, she had the skin crawling. Let me just end, please, by saying that the doctor who prescribed the 200 milligrams over the phone, when informed of Natalie's death, she was terrified and she screamed, oh my God, it doesn't make sense. I just saw her. She wasn't depressed." And the 2 things I want to leave you on, because I come from a family of medical practitioners, mental health practitioners, and doctors, is that a phone call is not seeing a patient, it's not a clinical assessment. And also, akathisia deaths have nothing to do with depression. Lastly, because my background is communication, I would just ask us to call these deaths what they are. They're iatrogenic. And even though modern medicine has created a situation where you can have self-inflicted harm or death, these are pharmacological interventions that end in adverse medical events that are fatalities. Thank you.
Thanks, Christina. The next video, we're just going to show a little of it. Katinka Newman is a British journalist, and she wrote a book, A Pill That Steals Lives, and here's a little bit of some of her words.
I took a pill that nearly turned me into a killer and took me away from my kids for a year.
You just seemed not with it, as if there was something else on your mind.
I started seeing very, very violent images. It was like everything was very, very brightly coloured. I took a kitchen knife and lacerated my left arm. I could easily have killed somebody.
If properly diagnosed and treated, akathisia-induced harm can be reduced. Akathisia is often miscoded and or misdiagnosed as panic attacks, You can read these all. So here's the thing about MISSD. We are not anti-drug. We are pro-doctor. In many ways, we feel that doctors have been misinformed in the same way as the public. We are simply a safe patient advocacy group. I am a social worker by profession, and I often refer my clients to psychiatrists when I feel that medication assessment might be beneficial. We have our free online CEU course that's meant for mental health care professionals. We are currently, right now, in the process of making one suitable for doctors, which will also be free for accreditation. Thank you for your time. Let's make akathisia a household word. And here are some of our, so thank you very much. I'm honored to be among such distinguished people. Thank you.
So thank you to all the speakers in that session, and particularly to the last two speakers for sharing something so personal and hurtful. Thank you.